Hi everyone, this is Dr. Hatami. In this video, we're talking about the blood vessels of the body. Let's start with the largest one in our body, which is leaving the heart, and it's called aorta. So aorta is coming from our left ventricle, and the blood pressure in aorta is the highest one. As the left ventricle pumps, it sends blood with high pressure to the aorta. So the aorta is going upward and making our ascending aorta. And then it's make an arch is called aortic arch, and then it goes down behind the heart, passing through the thoracic cavity and passing through the abdominal cavity and ending here at the level of L4, our fourth lumbar vertebrae. So we can divide the aorta to these three major types. Ascending aorta, the part is leaving the heart and going upward. Aortic arch, the part of the aorta is arching. And then descending aorta, which is the part of the aorta is passing behind the heart, going down to the thoracic cavity and abdominal cavity, as we can call this as thoracic aorta and also abdominal aorta. And each part is going to give some branches. So the first part of the aorta, which is called ascending aorta, it's giving these two branches to the heart wall itself. So we are going to have our coronary arteries right and left, which they are going to supply the right side and the left side of the heart, and these are the branches of the ascending aorta. And then let's go over the branches of the aortic arch. So the aortic arch is giving these three elastic arteries, the large arteries with lots of elastic fibers in their wall. So the first one at the right side is called brachiocephalic trunk. So let's draw an aortic arch like that. And then the first one is called the brachiocephalic trunk. The reason we call this as brachiocephalic trunk because it goes or it's going to supply the arm and also the brain or the head region, as brachio means arm and cephalic means head. So brachiocephalic trunk, then it's giving these two branches. One is going toward the arm and another one is going toward the head and neck. So the one of them is called subclavian artery and the other one is called common carotid artery, because that would be found on the right side. So the one branch is called right subclavian artery, which it goes to the arm and supplies the right arm and chest. And then the second one, it supplies the right side of the head and neck and is called right common carotid artery. The one artery in the neck region that we can take the pulse. And then second branches of the aortic arch would be called as left common carotid artery. So this one is left common carotid artery. So then it goes to the left side of the head and neck. And the last one is called left subclavian artery, which it goes to the left arm and chest. So these are the three branches of the aortic arch. First one, brachiocephalic trunk. Second one, left common carotid artery. And third one is left subclavian artery. And now, if you want to just practice, you can draw and label the aortic arch branches, which we have here. Our ascending aorta is giving these two right and left coronary artery, and then the aortic arch is giving these three branches. The first one is called brachiocephalic trunk, as is like a tree trunk giving these two branches. One is called the right common carotid artery, and then this one, it's going to the arm right side, right subclavian artery. And then the middle one is called left common carotid artery. And the last one, which would be found on the left side, that is called left subclavian artery. It's going to the arm, the left side, and also it's going to supply the chest area. Now let's take a look at the arteries of our upper limbs. So the blood supply to the upper limbs actually comes from the subclavian artery. Let's find the subclavian artery here in this picture. So this one, as you can see, like an arch-shaped artery coming from the brachiocephalic trunk at the right side directly from the aortic arch at the left side is called common subclavian artery. Subclavian artery travels down the limb and then at the armpit region it would be called as axillary artery. So then after subclavian artery we are going to have our axillary artery at the armpit region. And then axillary artery, it's going to the into the arm region, and it would be called as brachial artery. Brachial artery is important, especially in clinic, as we are going to use the brachial artery pulse, and also the blood pressure measurement can happen through this brachial artery. So that is an important artery in clinic. And then when brachial artery passing through the elbow, it gives these two branches. The branches, it goes toward the radius bone or to the lateral side of the forearm is called radial artery, and the one it goes to the ulnar side or to the medial side of the forearm is called ulnar artery. Radial artery is also important in clinic, as we can take the pulse of the radial artery when it's passing close to the surface at the wrist region. And then finally, this radial artery and ulnar artery in palm, they join together and make the palmar arches. Okay, so we talked about the subclavian artery, how it goes to the upper limb and then travel down to make axillary artery in the armpit region, the brachial artery in the arm region, the radial and ulnar in the forearm region for at the medial and lateral side, and then palmar arches in our hand. Okay, and now let's go and talk about the arteries of the abdomen. So as you remember, we have the ascending aorta, aortic arch, and then descending aorta. The part of the aorta passing through the abdomen is also called as abdominal aorta. It has some important branches giving the blood supply to the organs. The one it's giving the blood supply to the stomach, liver, spleen, and pancreas is called celiac trunk, and then it gives 3 branches to these organs. And then we have superior mesenteric artery, which eats the blood vessels in supplying the small intestine and also the proximal part of the large intestine. We have suprarenal arteries. The artery is supplying the adrenal gland or suprarenal gland, the endocrine gland just on top of the kidneys. Then we have renal arteries. The name of this artery is descriptive. Renal means kidney, and renal arteries is going to supply the kidneys right side and the left side. Gonadal arteries in female, it's giving the blood to the into the ovaries, and in male giving blood to the testes. So they are coming from the abdomen and going downward to the testes and ovaries. And then we have inferior mesenteric artery. These are going to supply the distal part of the large intestine and also rectum. And finally, at the level of L4, the abdominal aorta ends to the common iliac artery. So we have right common iliac artery, and then we have left common iliac artery. And each is split into the internal internal iliac artery and external iliac artery. Internal iliac artery, it goes to the pelvis and going to supply the organs of the pelvis, and external iliac artery continues to the lower limb, and it would be called as femoral artery in the thigh region. Now let's take a look at artery of the lower limbs. So as I mentioned, the common iliac artery is giving the external artery, so we can say the blood supply to the lower limbs comes from the external iliac arteries. Okay, and then as this external iliac artery travels down the leg, its name changes based on their location. When it's traveling to the thigh region, it's called femoral artery. When it goes back to the knee, it's called popliteal artery. And then popliteal artery behind the knee divides into the anterior tibial and posterior tibial when passing from the leg and back of the leg. And then each is going to make dorsalis pedis artery and plantar arteries at the dorsal and plantar surface of the foot. And now let's take a look at the major veins of the systemic circulation. Actually, if you know the name of the arteries and where they're going to supply, then you should know the veins. Like when we have the axillary artery gonna pass through the armpit, we have the same name as axillary vein, okay, which gonna be found in the armpit region. When we have radial artery, then we have radial vein. When we have the subclavian artery, we have the subclavian vein. Just the direction of the blood is different. It's going from the organs toward the heart. Okay, but there are some veins in our body, they do not have the same name as their arteries. For example, in the head and neck region, we have internal jugular vein and external jugular vein. So these are coming from the brain and also the head and the face, and gonna be released into the brachiocephalic vein. So instead of having internal jugular artery, we having carotid arteries. So we do not have any jugular artery, instead we have jugular vein. We do not have any carotid vein, we have carotid arteries. So carotid arteries are the arteries supplying the neck and head, and jugular vein are the veins bring back blood from our head and neck region to the heart. And then we have brachiocephalic vein. As we saw, we have one brachiocephalic trunk as the artery, but we have two brachiocephalic veins, right brachiocephalic vein and left brachiocephalic vein, which they formed by the joint of subclavian and internal jugular veins at each side. Right subclavian artery plus internal jugular vein giving the right brachiocephalic vein, and left subclavian vein and left internal jugular vein making left brachiocephalic vein, which as their name is descriptive, they're draining head, neck, and also upper limbs, brachio and cephalic. Okay, and then let's take a look at the major veins in our thorax, which we do not have the same name for their arteries. So we have superior vena cava, which is collecting the blood from the head, chest, and upper limbs. So instead we have aorta in arteries, so we have superior vena cava for vein in the thorax region. And in abdomen region we have inferior vena cava, the major vein collecting blood from all the structures inferior to the diaphragm or the lower part of the body, both legs, the abdominal area, and all organs found in the abdominal pelvic cavities. We have hepatic veins. So we have hepatic artery and we have hepatic veins, as hepato means liver. So it's easy. Hepatic artery sending fresh blood to the liver, and hepatic veins draining blood from liver into the inferior vena cava. That is easy, right? Easy and simple. Hepatic artery going into the liver, hepatic vein leaving the liver. bringing the oxygenated blood from the liver into the inferior vena cava. And then inferior vena cava would be drained to the right atrium of our heart, right? Okay. But there is another vein which is called hepatic portal vein. It is related to the liver as we have hepatic. But this one is portal vein. So hepatic portal vein is a unique vein carrying deoxygenated blood, but the blood full of nutrients. So this blood actually entering the liver. So enter the liver like the hepatic artery. But it's actually carrying the blood from digestive organs to the liver. So it means that it's going to bring nutrients which has been absorbed by our digestive organs to the liver. Instead of just bringing them to the heart directly, they're going to send them to the liver, and then hepatic vein is going to drain the deoxygenated blood from liver into the heart. And then in lower limb also we have a vein which we don't have the same artery. It's called great saphenous vein, which is a superficial vein. It's going to be found in the medial thigh and medial leg. So it's the longest vein in our body. It's coming from our foot going upward through the medial side, and then finally would be drained into the femoral vein. So the clinical application for saphenous vein is that this is actually the most commonly used vein in coronary artery bypass graft. So the great saphenous vein is taken out of the leg and used in the heart bypass surgery, because this is a long and easy vein to reach and is used to bypass blocked coronary arteries. So as you can see in this picture, so we are going to directly send blood from the aorta to that region which we have the blocked coronary arteries. Thank you.